Hello guys, myself Umama Sheikh and I'm going to explain about my topic anti-metabolites. Now, let's see the classification of anti-metabolites. Anti-metabolites classify into three categories. That is folate antagonist, purine antagonist, pyrimidine antagonist. Folate antagonists contain methotrexate, pemetrexate. Purine antagonists contain mercaptopurine, azathioprine. Pyrimidine antagonists contain fluorouracil, capecitabine. Now start with methotrexate. It is the oldest and highly efficacious anti-neoplastic drug. It acts by inhibiting dihydrofolate reductase, thus blocking the conversion of dihydrofolic acid to tetrahydrofolate. It is mostly preferable drug. Now the mechanism of action. So basically the methotrexate act by decreasing the DNA synthesis. Its main action is by decreasing the DNA synthesis. So its pharmacokinetics. It is absorbed orally and 50% of plasma protein bounded. Largely it is excreted in unchanged form in urine. So, now we will study its adverse effect. Its major adverse effect is toxicity to the bone marrow. Low doses causes megaloblastic anemia and high doses cause pancytopenia, mucositis and diarrhea. Now next drug is pemetrexate. It is a co-genre of methotrexate. It primarily targets the thymidate synthesis. In combination with cisplatin, it is approved for the treatment of mesoepithelioma and non-small cell lung carcinoma. In other combination, it is used for breast, bladder, colorectal cancer. Its adverse effects are: it is painful, itching, erythematous rash, mostly involving hand and foot, which is known as hand-foot syndrome. Now, the next drug is mercaptopurine and theogonine. It acts by inhibiting the adenine and guanine synthesis. It also acts by inhibiting the de novo purine synthesis. It is widely used drug. Now its adverse effect, we will study its adverse effect that contains: it causes bone marrow depression, nausea, vomiting. It produces the incidence of jaundice and hepatotoxicity. Means it causes damage to liver also. So it also causes hyperuricemia. Now the next drug is azathioprine. It acts by converting into its active form, which is 6-mercaptopurine. It is immunosuppressant which suppresses the cell-mediated immunity. Its uses are: its use in organ transplantation, rheumatoid arthritis, ulcerative colitis, and it is mainly used in autoimmune diseases. Now the next drug is fluorouracil. It is converted to its active form, which is 5-fluoro-2-dioxyuridine monophosphate. Then forms a ternary complex with methyl THFA and thymidylate synthesis, which decreases the DNA synthesis due to non-availability of thymidylate synthesis. Now its uses. It is used as an anti-cancer drugs for many solid malignancies, especially for the colon, rectum and stomach, pancreas, head and neck cancers. Next is capecitabine. It is orally active product of 5-FU. Means it is orally active. After absorption, it is converted to deoxy-5-fluorouridine in liver and then it is released in the blood. It is used in the second line of a treatment of metastatic breast cancer along with docetaxel. Now, next drug is cetarabine. It is a cysteine analog. Is phosphorylated in the body to corresponding nucleotide, which inhibits DNA synthesis. Now, its uses are lymphoblastic leukemia in children and adults, in chronic myelogenous leukemia, and for non-Hodgkin's lymphoma. Major toxic effects are due to bone marrow suppression, leukopenia, thrombocytopenia, anemia, and mucositis, and delayed pulmonary complication may also occur. Now let's start with MCQ. So the first MCQ is, which of the following are the pyrimidine antagonists? So obviously fluorouracil is a pyrimidine antagonist. And mechanism of action of methotrexate. So we already know methotrexate acts by decreasing the DNA synthesis. So the option A is right, which is not a use of azithromycin. Azithromycin is used in rheumatoid arthritis, ulcerative colitis, organ transplantation, but it is not used in gout. Pyrimidine antagonists have not which of the following uses. So the pyrimidine antagonist is used in antipsoriatic, antifungal, antineoplastic, and it is obviously not used as an antihelminthic. Which is the adverse effect of methotrexate? So the main adverse effect of methotrexate is mucositis. So thank you.